This is another installation of Petrides Pearls. In this video I will be demonstrating the anterior pass using the Safina Venipec system, keeping the tunnel dry. After finishing the posterior pass, look for branches at 9 o'clock and 3 o'clock as you go back to the trocar. When doing the anterior pass, I like to create windows at 10 o'clock and 2 o'clock to avoid contact with the vein. I like to use the conical tip to elevate the adventitia, cauterize and cut it as I move forward, keeping the tunnel dry. Gently dissect at 2 o'clock and 10 o'clock, retreat and take the adventitia with the blades. The key is to protect the vein with the conical tip during the anterior pass. Create windows above the vein to take anterior fascia, always protecting the vein with the conical tip. The main technique is to window at 10 o'clock or 2 o'clock, retreat, place the tip below the tissue, and take the adventitia. Here I'm just demonstrating windowing at 10 o'clock and 2 o'clock and taking down the adventitia with the blades, keeping the tunnel dry during the entire pass. I generally prefer to keep my conical tip below the vein and adventitia in the posterior open tunnel when I take down my adventitia. I also like to advance posteriorly into the open tunnel when doing my dissection and making my windows. Here I'm just spot cautering a bleeder, which I like to do during the entire pass. Try to stay at 10 o'clock and 2 o'clock to minimize contact with the vein. Here I'm just making my window, retreating, and then I like to rotate into the posterior tunnel to take the adventitia. If you discipline yourself, window, retreat, place tip at 7 o'clock or 4 o'clock, and take the adventitia down with the blades, you'll have a dry tunnel during your anterior pass. I'm just continuing to apply the same technique of windowing at 10 o'clock and 2 o'clock, retreating, and using my conical tip to elevate the adventitia, cauterize and cut the adventitia while protecting the vein. This technique will keep your tunnel dry and give you a nice view during the anterior pass. Another technique I like to employ is when I make my windows, I advance into the posterior tunnel, which is open, trying not to make contact with the vein, and then employ the same technique after I make the window. At times, it is necessary to do some dissection at 12 o'clock. Most of the time, I like to be at 10 o'clock and 2 o'clock to make my windows. I'm just continuing to keep the tunnel dry. I cauterize anything that looks like it may bleed or is bleeding. And this will keep your view clear during the entire procedure. Here I demonstrate that same technique where I create small windows directing my tip posteriorly. Then retreating, elevating the adventitia, and taking down the adventitia with the cautery. This technique will eliminate the necessity to run the vein and look for branches and adventitia at the end of the case. Now I would like to demonstrate how to take anterior branches without damaging the intima at the base of the branch or avulsing the branch. I like to dissect beyond the branch on the vein, but again, avoid dissection directly at the base of the branch. Use the blades to open up the space, cauterizing, cutting the adventitia past the branch. Avoid putting stress on the branch at the base. Again, dissect past the branch. Now I'm going to window by using counter traction with my opposite hand on the thigh, pushing fat into the tip. Again, don't do dissection at the base of the branch. It's not good for the vein. Continue to open the tunnel with the blades, and this will reduce bleeding when you go to cut this branch. It's an extra step, but it's important to keeping a dry tunnel. Don't just push through that. Use your blades to cauterize, open the space up beyond the branch, and address all bleeders as you go. So while you're doing this, if you get any bleeding, go ahead and cauterize the bleeding. To clean off your tip, just press it against the side of the wall and the debris will come off. Now you have a clear view and you can take this branch with excellent length and you had safely dissected it and opened up the tunnel. Continue to do your dissection using the same discipline technique. This technique and approach with the anterior pass will allow you to see everything clearly and keep the tunnel dry. Window moving posteriorly into the open tunnel and take tissue with the blades. Now I would like to demonstrate how to safely take an anterior branch and ligate using the pullback technique. Use counter traction and avoid dissection at the base of the branch and dissect beyond the branch. Then open the window with blades to keep the tunnel dry. Always make sure your conical tip is on the same side of the vein as your blades. Use counter traction to continue to make windows as high up on the branch as you can. Then use your blades to open the window. Avoid overuse of your conical tip and dissection on these anterior branches. Dissect on the vein beyond the branch. This will help you gain length. By taking the time to open the tunnel beyond these anterior branches, notice the length of the branch I have without dissection at the base of the branch. This is important for vein quality, but notice the base of the branch is not stripped of vasovasorum. To do the pullback technique, close on the branch, then engage your bovie, open up just a millimeter, and you'll see a flash. That seals the branch, then move to the crux of the blades where they come out, cauterize again, then pull the blades back, at the same time advancing forward 3 millimeters. The branch is sealed and the tunnel stays dry. Notice the windowing is done anteriorly and the adventitia is taken posteriorly. This retreating is going to eliminate the need to run the vein at the end while the vein's just sitting on the bottom of the tunnel. This is a much easier way to ensure all branches and adventitia have been taken. I just continue to employ this same easy to learn technique and my tunnels have been dry, and my view has been excellent on the anterior pass. On this last branch, I employ the same technique for anterior branches by using counter traction and pushing the fat into the tip and dissecting on the vein past the branch. You don't want to put stress at the base of these branches. That's where avulsions occur, and that's where you can damage the intima of the vein. So use counter traction, stay off the base of the branch. And once you window, sneak in and take the adventitia down. Now sometimes you can just take adventitia down away from the vein. Again, these blades do not get hot. The energy is just on the inside. So I'm going to dissect by using counter traction, pushing the fat into my tip, and then cauterizing those windows to keep them sealed. Now, on this particular branch, you'll notice I did not seal the last window right here, and I had to go back after I took the branch down to dry it up. So here I employed the pullback technique again, where I close, engage the bovie, open a millimeter, advance to the crux with the bovie continuing to go, pull back my blades and move forward with my tip. But notice, because I rushed this one a little bit, I had a little bit of bleeding to manage after I took the branch because I didn't seal my windows first. Now near the end of the tunnel, it's okay to put the tip on top of the adventitia and then move posteriorly. It's just the way the vein sits up at the end of the tunnel. So you notice my conical tip is not posteriorly, it's anteriorly, but I'm still advancing into the posterior tunnel. It's a lot of in and out during your anterior pass, and you're avoiding that run of the vein at the end, which is sometimes difficult to do, and it's an extra step that you don't need to do if you employ this technique. When you get to the end, it's important to dry this part of the tunnel up. There always seems to be more little arterioles and venules here. If you get any bleeding with dissection, address it right away. And again, spot cauterize, and when you're done, just advance the tip into fresh tissue. That'll clear it. To spot cauterize, open blades, engage your bovie, and then close them till you see the spray. And here, I'm going to take care of this bleeding and adventitia at the same time. So it's important to clear off the adventitia, look for bleeders before you extract the vein so it doesn't get caught on anything. At this point, you can see anything that's red or bleeding and take care of it. Get advanced to clear the tip, and now you can see perfectly clear. This little stuff, it's important to take before you pull the vein out. Sometimes it gets caught on this, trying to extract it, and you want to get this all done before your stab and grab. And I'm just taking care of any little bleeder now. Continue to employ the discipline technique. Spot cauterize when you see something. And I like to do my stab and grab by putting a cryo in, spreading, and then I send an Alice clamp in afterwards to scoop the vein out. I don't lose the length behind the clamp now. When I pull this out, I slide my clamp outside the leg down to the skin, and I gain sometimes a full inch of vein. Lastly, to extract the vein, just point the score at the vein, reach back with your blades at the end of the vein, close gently on it, and pull it out. And now you have a dry tunnel, and you're ready to prepare your vein.